Live from the 710 WOR studios in Lower Manhattan, it's Back Talk Live with Dr. Ed Kornel.
Hail, oh, hail, Dr. Kornel.
Doctor, give me the news. I got a bad case loving you.
The ratings are in, and Back Talk Live has quadrupled its audience in the past 3 months. Back Talk Live is the show where we help you figure out what's making your back or neck hurt or giving you brain problems. As a practicing neurosurgeon, I operate on the brain and spine. I'm here to give you great medical advice about your brain, neck, and back tonight, but not treatment. Why, Bobby?
Just like those two ladies say at the front desk of your office, no copay, no treatment.
No, it's because I can't examine your reflexes over the radio.
Oh.
So you've got a problem with your L3-4 disc?
Yeah, I just went and had an MRI done, and he said that they're bulging discs, and I've been going to a chiropractor, and it's helping a little bit. But I go for a period of time, and then it starts to get worse again. I wonder if there's any way to fix this.
Tell me what your symptoms are when you say it starts to get worse. What is it?
Well, in the worst case, it's like I can barely put my socks on. It hurts when I walk. It hurts when I sit.
Your back?
Yeah, down my lower back.
Mm-hmm. And do you get pain down your leg at all?
Not really, no.
Okay. Well, a lot of people do have bulging discs. It's not uncommon, but in a percentage of those individuals, there's a marked degeneration of the disc where the disc itself can generate pain. And in those individuals, there are a number of things that can help. The physical therapy may be helpful. Chiropractic may be helpful. Epidural steroid injections may be helpful. But in the long run, if you're suffering from it for years and it progresses and isn't improving, then you may need to have either a fusion, meaning the disc has to be removed and a cage has to be placed in place of the disc so that bone can grow through it and fuse that disc so there's no movement there anymore, or an artificial disc can be placed, and those artificial discs are becoming perfected, and that may be very helpful. So I would urge you to see a rehabilitation specialist about it, and in fact, you could see someone at Spine Options, and they may be able to help you greatly.
My question is, I had an accident back in October, and I had a bad whiplash. I went to a chiropractor for about 5 weeks, got a little better. Then I went to a physical therapist for like 6 weeks, got a little better. Still had issues, had an MRI, and I was diagnosed with the Chiari. And so I had surgery, and but my doctor, he told me that it was something I was born with. But I never had any issues with any pain before I had the accident.
Well, Karen, that's very interesting because we've been speculating about whether the new onset of Chiari causes symptoms, and it certainly may. There's no way, now that we've done this study, to know whether, in fact, you had a Chiari that you were born with or whether this was a result of the car accident. And we've always assumed, I've seen patients after a car accident who were never worked up before and never had a problem before who have a Chiari malformation and who end up having surgery. I've operated on a few of those, assuming before we did this study that, in fact, it had existed previously, and we just assumed that it had become symptomatic. But now we think differently. We think that, in fact, it may be secondary to the car accident. Hi, Paul.
All right, here's the situation. I'm a pretty explosive person. I'm generally getting into a very overheated argument that I just sometimes get so contortioned in my face that I think I'm going to have a stroke or break something. So this is the first time I ever went to my doctor. I've had this for many years because I can control myself. However, I still have a headache, and I thought maybe he would have sent me for further examination.
But Paul, is it correct that you somehow got into a fight and that you were hit, and that's how you started having your headache? Is that what you had mentioned to our producer?
I was not hit. I was so explosive emotionally, stressfully, I thought perhaps I may have had a mini stroke.
Oh, and you've had a headache since then, or did you just have a severe headache that started to resolve?
Well, truthfully speaking, I always have this kind of headache because I've been on Vicodin for 4 years now, hydrocodone, because of herniated disc, and maybe that's part of parcel.
Where's your
don't know.
herniated disc? In your neck or in your back?
In my back, but I also have some kind of arthritis in my neck.
Well, it sounds like you're under a lot of stress. And so I would say that the first thing you need to do is to get relief of your stress. And you should talk to your doctor about going on a medication that reduces your anxiety level. And, of course, pain can add to stress. And being on a long-term narcotic doesn't help with your responses. And sometimes that can result in headaches also. And it sounds like when you get really upset, your blood pressure may shoot up, and that can also cause headaches. So,
like the Incredible Hulk.
Yeah, so I think the number one thing that you need to do is to talk to your doctor about finding ways to relieve your stress and your anxiety level, and perhaps see a therapist to help you to resolve these issues. Thanks for calling, Paul. Hi, Carrie. You've got a neck problem that came from an amusement park accident.
Yes, actually, I took a herd of Girl Scouts to one of the amusement parks in the area, and I was the designated adult to go on the ride with the girls. And following the amusement park, I've come home, and I've been having this pain in my right hand, in my first three fingers, my thumb, my first finger, and my second finger. It's like a numbness.
So you went to the doctor and they found that you had a disc problem.
I have a problem with Dr. Kornel. I have spondylolisthesis.
We talked about that a couple of weeks ago.
Oh, you did, and I missed it. I must be sleeping, but I'm getting contradictory stories whether to get surgery or not, and I just don't know what to do.
Well, that's a very complicated issue, and I wish we had more time to talk about it, but what I would like you to do is give me a call on my cell phone, and I'll be happy to discuss it with you in more detail. So call me up. Bobby will give you my phone number, and I'll be happy to discuss it with you further.
Right,
but now we've got attorney Chase D. Lambudance on the phone. Attorney Lambudance, how are you?
Oh, my goodness.
Well, how are you, Dr. Sandy and I remain absolutely sky high because you have brought knowledge to the American people about the dangers of whiplash, and you've just touched the tip of the iceberg because you haven't even gotten into the other things that result from whiplash, like irritable bowel syndrome and diarrhea and constipation and polio and insomnia and ability to wake up and snoring and flagellants while on the phone with the IRS. That's been a new development.
About 5 days ago, when I got up from a chair, I had a terrible pain.
Did you have trouble with your back before?
No, never.
And where was the pain?
The pain, my buttocks.
And has it persisted?
What do you mean?
Has it continued on since the 5 days ago?
Yes, when I sit down, I hurt, especially when I get up.
And if you walk, does it bother you also?
No.
Do you have any pain radiating down your legs?
Oh, sometimes when I get up and I have to walk, it's a little hard for me to walk.
Because of weakness or because of the pain?
I don't know.
How old are you, Sarah?
89.
Oh, bless you.
Yes, bless you.
Well, as we age, our discs do get weaker, and it is certainly possible that that one of your discs could have given out. It's also possible that you sprained a muscle or pulled ligaments. Do you have any numbness or tingling?
No.
And your bladder is working fine?
Well, my bladder, I go to the bathroom a couple of times at night, but that's an old story.
Okay, but nothing new. That's good. Because if you had bladder problems, that would be an emergency. So, Lydia, what would you suggest for Sarah?
Well, at this point, then I would have her evaluated, preferably, to your doctor, chiropractor, to evaluate you. It doesn't, there could be some disc involvement, but a thorough examination would be needed.
You should get examined. A physiatrist or a chiropractor could give you a good exam, and then from there have an idea of what the problem might be, and then move you forward. Hi, Melton. So I understand you're having tinnitus?
Yes, Dr. Kornel.
Yeah,
yes,
that can be very disturbing.
How
long have you had it?
6 years now. I was punched in my ear in Central Park when I was assaulted 6 years ago.
Oh, sorry to hear that.
And it came on 2 days after the blow. And I've been through a lot of medical doctors, and they can't seem to find it.
And everyone thinks that Central Park is so safe, but I guess it does still happen that people get assaulted. I'm really sorry to hear that.
Were you able to punch the guy back?
Yes, sir.
I want to explain what tinnitus is for those who don't know. It's a ringing in the ears.
Yes.
And it's something that you have a hard time getting away from, so it just is very disturbing because it's always there and you can't ignore it. And so have you seen a ear, nose, and throat doctor?
Yes, I've had CAT scans and I've had MRIs, and they can't seem to find the damage. So they tell me it's probably an affective nerve of some kind, but they don't know exactly where.
Have they done electrical tests, what's called the brainstem auditory evoked response?
No, sir.
Have they done tests for dizziness or unsteadiness?
Yes, I've had that done, and they claimed I don't have Meniere's disease.
And you don't have unsteadiness?
No, I used to, before even the tinnitus from the blow. But I never had any ear problems in my life until I was struck that fatal day on June the 4th. I'll remember it as long as I live. And I'm 72, I'm 78 now.
Well, do you find that if you're listening to music with headphones or something like that, it can reduce the tinnitus a bit?
Yeah, usually I try to, when it's really bad and I'm trying to go into a restaurant to have something, I will put on my headset because otherwise it would be so upsetting I really couldn't have my meal. So
yeah, I think you've sort of come up with the best solution. It is a big problem. There's some medications that sometimes help, but there are some ENT doctors that are specialists in tinnitus and in balance disorders. So I would urge you to see one, and if you want the name of someone, I can give it to you later. If you give Bobby your phone number, I'll be happy to get back to you and give you the name of that person. So,
and if I may interject.
Oh, please.
Also, there are vestibular therapists that work with these type of conditions as well.
Right. So if you give us your number, we'll get you some more information. And we're sorry about the trouble you're having. Thanks for calling, Milton.
Arms.
Well, Cindy, what kind of symptoms are you having? Are you having pain just in the elbows? Are you having pain radiating down the arms? Are you having neck pain with the arm pain?
Is there any tingling, pins and needles?
Yes, this is what just started happening. First, it was just the arm tingling and swelling. Now, my fingers and my hand, sometimes I feel like I lose strength in my right hand more than my left hand.
Well, do you have neck pain also?
Yes, now it just occurred because...
Well, Cindy, this could be more than just a tennis elbow. This could actually be a disc problem in your neck. It could be a herniated disc. Yeah. So I think you need to get this looked at sooner rather than later. You need to see a physiatrist like the physiatrist that we have at Spine Options, Brad Cash, and the place like that. You can get examined and you have your problem resolved. You can have it analyzed. You need to see what's going on, and you need to begin treatment right away, because if it's a big herniated disc, it could give you significant long-term problems. So please have it checked out, okay?
We have time for one more call tonight. Hello, Back Talk Live.
Who's on the line? Is that Reverend Frank again?
Well, Dr. Kornel. First, I want to thank the Almighty. Enough people sent me money that I prayed Hurricane Earl away. And do you know what happens to the sinners who don't send me money?
What's that?
They become your patient, Dr. Kornel.
Oh, that's cruel. That's cruel.
How dare you try to transform Dr. Bifford's office into a Laotian whorehouse? How dare you? Why, this poor doctor doesn't know the likes of you, Dr. Kornel.
I don't think that's very fair to say about Dr. Bifford.
She's an esteemed chiropractor.
Let me tell you that for every $100 that people send to me, I can pray away 5 sins, except tomorrow, Labor Day. I have a special. If they send me $100, we'll add 2 more sins that will get prayed away. Send it to Post Office Box BS, Atlanta, Georgia, to Reverend Frank.
Well,
it is fair.
You know what, Reverend Frank? Reverend Frank, it's cheaper for me to pray away my sins on Yom Kippur. I think I'll do that rather than send you the money. Thanks, Reverend Frank.
All things good and holy. Reverend Frank, our spiritual advisor here on Back Talk Live. Back Talk Live is sponsored by Sleepy's. Is your back pain a total nightmare? Sleepy's expert mattress professionals will find you the perfect mattress to put your aches and pains to bed. Sleepy's, the most trusted name in mattresses.